Good afternoon, everyone. Today we mourn 8 further COVID-related deaths in Northern Ireland, and my deepest condolences go to the loved ones and to those who have lost. To those who think this pandemic is over, please think again, because we still have work to do. We still need to focus on protecting each other. And I want to make a personal appeal today to everyone aged 60 plus who has not yet booked their vaccination. Please don't delay. Vaccination appointments are available for this age group at each of our 7 regional vaccination centres, and they can be booked online or by telephone. We will shortly be extending the programme to other age groups as well, so there will be soon be more pressure on those slots. So book now, don't hold back. Spread the word to people in this age group or other groups that have already been called. Tell your friends, tell your relatives, and tell your neighbours, and get your vaccination booked in. Because vaccination provides an important protection for the virus. It is our bridge to better times and to more freedoms in our lives. I am pleased today to confirm that the number of first doses administered in Northern Ireland has pushed through the 600,000 mark. That's another landmark passed. I can also confirm that significant additional quantities of vaccine have now arrived and are currently being distributed to GPs, and it is the biggest delivery that we have received to date. Supplies to GPs had slowed up in recent weeks, but that's all changing. The pace of the programme will accelerate, and we will be announcing the next stage of the rollout early next week. In addition, today our first online COVID vaccination dashboard has gone live. It is the first step in plans to publish detailed daily data on vaccinations, and a more comprehensive dashboard is currently in preparation. I am committed to improving the regular flow of information on the programme, because this will help us to chart our progress as the programme advances through the various age groups. Vaccination, of course, is not the only line of defence against the virus. Test and trace is also vital. Today, I have also announced an important expansion of the testing programme for the workforce in key sectors. This will help us to test and find the virus and to stop it spreading. This expansion will involve rapid turnaround tests. Shortly, we will hear from Matt Willis, who I have asked to lead the expansion of our asymptomatic testing programme across Northern Ireland. Matt has a breadth of experience, both in leadership and logistics, that makes him a perfect fit for this crucially important role. To emerge from lockdown, we need to use every instrument at our disposal to identify and target outbreaks that may occur across different parts of our society. New testing technologies make it possible to test at a greater scale, frequency and pace than had previously been possible. We can test and find cases that would otherwise go undetected as people who were not displaying symptoms. This expansion of testing is another example of how we can build resilience in our community and help keep the virus under control. I fully understand the calls for restrictions to be relaxed, and I understand the impatience, because I can feel it too. However, we still have to tread carefully and never underestimate this virus. We have to build steadily on the progress that we have made, because we are turning the corner. So let's keep going. I'll now hand over to Matt to give an update on the new testing programme. Matt.
Thank you, Minister, and thank you for inviting me today to provide an update on the workplace testing programme. My name is Matt Wills, and I am the lead for the expansion of asymptomatic testing across Northern Ireland. Earlier today, the Minister announced the start of this expansion to the testing programme to include key employers within public and private sectors and local government. As a first step, the programme will be guided by a number of key principles, which are as follows. Firstly, workplaces performing critical functions or delivering key services. Workplaces with more than 50 employees who cannot work from home. And thirdly, those who may have a higher exposure to risk of infection for staff or for customers. We looked at the available evidence on infections in the workplace, sought advice from other government departments, including the Department for the Economy, as well as business bodies, and have prioritised 4 sectors within the first phase of this programme. These 4 sectors are agri-food, manufacturing, essential retail, and construction. We have already successfully introduced testing for staff and pupils in some schools, universities, for frontline healthcare staff, and for those working in TransLink. We are also continuing to work closely with central and local government to identify and prioritise other sector organisations which may benefit from the testing programme. New technologies make it possible to test at far greater scale, frequency and pace than has previously been possible. The use of lateral flow tests, or LFTs, gives us the opportunity to expand our approach to test people who do not display symptoms across a range of settings in Northern Ireland, with the overall objective to ensure a safer return to as normal a society as possible. LFTs will give a result in 15 to 30 minutes. Individuals with positive results will have to isolate immediately along with their households. They should then book a PCR swab test at their closest test site to confirm the result. If the PCR test is positive, then community contact tracing will be initiated. If the test is negative, there will be no need to continue isolating. The support of business and industry will be critical to the success of this programme, and I strongly encourage those who are eligible to consider coming on board. Details are available on the Department of Health website. It is also important that employers and employees are aware of and can access support if they are required to self-isolate, and information will be available to individuals and businesses at NI Direct and NI Business Info. In conclusion, this is the first step in a testing programme, and consideration will be given to how it can be further expanded. This approach allows us to quickly identify positive cases and break the chain of transmission. It is crucial to maintaining continuity of services in the future and ensuring a safe return to as normal a society as possible. But please don't forget, asymptomatic testing is just another tool within a range of measures already in place: social distancing, hand hygiene, and face coverings. That is all I have for you today. Thank you very much for listening.
Okay, thank you, Matt. And now hand over to our Chief Medical Officer, Dr. Michael McBride.
Thank you, Minister, and thank you, Matt. Can I also take this opportunity to express my deepest sympathies and sincere condolences to the family and friends of those who have lost loved ones to COVID-19. The plans for major expansion of rapid testing is very welcome, and it's that opportunity to break those very important chains of transmission, knowing as we do that up to a third of people with COVID have no symptoms whatsoever. And this will provide another important part of our defence system against the virus. Our defences, as the Minister has already alluded to, include the vaccination programme and, of course, as well as the ongoing improvements that we are seeing in the treatment and care of people with COVID and the many people who remain in hospital at this time. The terms of engagement in our battle with COVID have certainly altered in our favour, especially by the successful development of and the continued rollout of the vaccine programme, which continues to be ahead of schedule. But the battle itself is not over, let alone won, and it is important that we do not drop our guard at this time. I know some have indicated that they believe we are being too cautious. However, it is my job and others' job and my absolute responsibility to spell out the public health position based on the evidence and to explain the uncertainties so that all decisions are fully informed. And that includes the inevitability that as restrictions ease and more mixing happens, case numbers will rise, more people will get sick, and sadly, some people will get very sick. Now, against all of that, of course, we cannot stay locked down forever, and the restrictions themselves are hugely damaging to society and to individuals. That has damaged lives and they have damaged livelihoods. It is quite rightly for ministers to evaluate the public health evidence, to assess wider societal and economic consequences, and to decide how we ease out of lockdown. None of this is easy or straightforward. There are many uncertainties, and there is more than one route out of this. I know people are fed up. They want their old lives back. I don't only understand those views, I want that too. We all need to remain cautious, and we all need to remain vigilant. And that's the part we can all play in ensuring the restrictions are eased carefully, properly, and sustainably. That's how we build towards a better and a freer summer. So follow the public health advice, stay at home as much as possible, cut down on unnecessary contacts with others, practice social distancing, please avoid crowded indoor places, and especially if ventilation is poor. I also want to make an appeal to younger people in our community. I know they feel the frustration particularly intensely. What they have done in the past year, the sacrifices they have all made, has been truly remarkable. They have put their lives on hold for the sake not just of their own grandparents and parents, but other people's parents and grandparents that they don't even know, and I want to thank them for that. I know with the weather getting better in the coming weeks, there will be greater opportunities and indeed temptations to mix and meet up with friends. Please don't, not just yet. Please celebrate St. Patrick's Day respectfully within your own household, and likewise for Easter. I now want to take the opportunity to describe in some slides the course of the pandemic here in Northern Ireland over the past week. The first slide shows the 7-day rolling average of new positive cases, and as we can see, this has continued to decline over the course of the past week as a consequence of the decisions made by the Executive and the restrictions that came into place on the 26th of December, and as a consequence of your actions. This slide shows the incidence by local government districts per 100,000, and over the last week we can see a fall in most local government districts. There has been a small increase in Ards and North Down, and we can see from this slide that Fermanagh and Omagh again has the lowest incidence per 100,000 compared to the other local government districts. This slide shows the 7-day cumulative total cases per 100,000 of the population in the time period from the 25th of February up to the 3rd of March, and this information is published and in the public domain. Numbers are changing rapidly across the common travel area, generally following, as you can see at the time period in question here, Northern Ireland had a higher incidence than Scotland, Wales and England, but lower than the Republic of Ireland. This slide is from the Office of National Statistics COVID-19 infection survey and shows the estimated percentage of the population in Northern Ireland. You can see there the second bar estimated at 0.31%. If you cast your minds back, not too many weeks ago in January, that was at over 2%. And you can see the gap between ourselves and the other jurisdictions has now narrowed. This slide shows the 7-day rolling average of first COVID-positive hospital admissions. And again, this continues to fall, as indeed does the total number of COVID-positive patients in our hospitals at this time. And again, you can see this is now below the spring peak of last year. This slide shows the numbers of COVID-positive patients in our intensive care units. By contrast, we have seen a small increase in people in ICU over the course of the last week, but this is against a general background of a slow, gradual decline in people in intensive care. And as we know, many of them will remain there for some many weeks. Thank you, Minister.
Thank you, Michael. Sharon O'Neill, UTV.
Hello there, Minister. First of all, to do with those scenes on a few days ago, the hundreds of Rangers fans, did your heart sink when you saw those scenes, and what are the potential consequences of super spreaders as a result?
Sharon, look, let's be clear, it shouldn't have happened. And the club has urged fans to follow government guidelines. Stephen Gerrard has said the same. But I think one thing that we shouldn't allow those things to descend into is a series of whataboutery. All our rules are there for all our protections, and we are asked not to mix with others and to keep ourselves safe. So somebody arguing that because somebody else broke the rules it's okay for us to do it doesn't make sense. Two wrongs don't make a right. This virus does not care what foot you kick with or what sport you follow. So the potential of there being spreaders within that crowd, we will wait to see now over the next few days in regards to testing and our outbreak reports reported by PHA. It will be unfortunate and it will be regrettable if that event does lead to an increase in COVID infections within that area.
And obviously we have St Patrick's Day coming up. Dr McBride there. There's a party ongoing at the moment in the Holy Land. The police have just turned up. I mean, what would you say to those young people who are still involved in these type of parties coming up over the holiday period?
Well, look, I mean, I've said this before. You know, it's hard to think that it was almost a year ago when I made these comments, but some people really need to wise up and grow up. People are still dealing with the consequences of COVID-19. There are 8 families grieving today, as the Minister has said. There are many, many more people in hospital. There are family members who are concerned about the outcome for those individuals. So please, all of us, let's stick with this. You know, we all know what we should be doing. We know what we shouldn't be doing. So please continue to do the right thing.
Okay, thank you, Sharon. Leslie Ann McKeown, BBC.
Yep, good afternoon. Minister, you've previously said that you want to see all care homes facilitating visits. So were you surprised to hear the Older People's Commissioner this morning say that that's not happening everywhere? And what action can be taken to ensure that all homes do follow the guidance on visits?
Thanks, Leslie Ann. I actually spoke with the Older People's Commissioner a few days ago on this specific subject. Officials, have advised me that over 95% of our care homes who now regularly submit returns to confirm that they can support visits and are currently facilitating those, and that's the conversation I had with Eddie as to how we actually use our combined resources to make sure those are happening. In the most recent return, it was indicated that over in the region of 75% of our care homes had adopted some sort of facilitating for indoor visiting rather than just the window visits. So we did make the change actually last Monday in regards to the alert level. That came down from level 5 to level 4, which expands the opportunity for visitors as well. But I would say a large number of our care homes can safely facilitate visits. So that undermines the argument I think that others make, which are there saying they can't do it. We really want care homes to do the right things, to be willing partners with us, because we have supported them through testing, through vaccination and through financial supports as well. So if we have to go beyond that, I've said that before, and take further steps, then that's what will happen, and we'll gladly work in conjunction with the Older People's Commissioner to do that.
Thank you. On a separate issue then, following yesterday's finding by the High Court in London, where Northern Ireland's Chief Scientific Advisor lost a court challenge against the GMC, how will Northern Ireland's fight against COVID be affected by his absence, and how can you reassure the public that the Executive is receiving the best possible advice on how to deal with this pandemic?
In regards to that, our deputy chief scientific advisor stepped up into that role in regards to the absence when Professor Young went off on sick leave. So that gap has been filled. Stuart Elbrorn from Queen's University is also filling some of the representation duties on nerve tag and other bodies. Our deputy chief scientific advisor, Professor Declan Bradley, is attending SAGE and does attend the executive now on a weekly basis, providing that same support as Declan had already chaired some of our working groups within the department. Rebecca Black, PA.
Evening all. Is there any figures that exist on previous super spreader events to really illustrate the starkness of how one event can lead to a multiplying of cases? There was examples in the Republic were given and they were very stark and effective. Is there anything like that can be given for Northern Ireland?
Rebecca, it's work that has been undertaken by the Public Health Agency. We haven't made any of them publicly available because of the size and nature of Northern Ireland, where individuals can become quickly identifiable. I think if you do record, I think one of our first outbreaks was due to a karaoke party in a garage, and I think it was in the Coleraine region a way back, and very shortly people within the community were identified personally in regards to that. So we have to be careful in regards to the information that we do actually share. Michael, do you want to?
Yes, thank you, Rebecca, for the question. I mean, obviously these events do occur. They're a recognised phenomena with all of these SARS-related viruses. We saw this also over time with similar type viruses. As Minister said, we have seen such outbreaks here, which are associated with a large number of cases. That information is not disclosed into the public domain on the grounds of obviously patient confidentiality. However, those cases are very actively followed up. Some of the information has been reported in the public domain. It occurs at a variety of venues. I'm aware that media reports in the recent days about a super spreader event or cause for concern, for instance, at a funeral service, which, despite all the precautions that were taken at that time. So this virus is a very transmissible virus. We know that the new variant, so-called B117 or Kent variant, is dominant now throughout these islands and indeed across much of the world and other countries, and it is a much more transmissible virus. So it is highly likely that we're going to see more of these events, and certainly as community rates fall and as restrictions are eased, we are likely to see clusters and outbreaks, and some of those will be the sort of super spreader event that you've referred to.
Thanks for that. Is it possible, without mentioning any specifics, to give the figures from the very worst that's been encountered? And also, Dr. McBride, can I ask for what your assessment is of a potential third wave of the pandemic in the autumn?
I think in terms of, I don't have specific figures in terms of maximum numbers to hand, Rebecca, so I can't provide that at this event, at this time. In terms of the likelihood of further waves of the virus, I think that's why the Executive has taken the approach in its pathway document to take a phased, gradual approach, not bound by dates, but by data in terms of how the pandemic is behaving. As we've said, we have a very successful rollout of the vaccine programme, but no vaccine is 100% effective. Not everyone will take up the vaccine who is offered it, and even if they do, we cannot guarantee that everyone will get the protection or absolute protection. So as we ease the restrictions, we will see more cases. The more rapidly we ease those restrictions, there is a risk that the virus will get out of control, and if that is the case, then we certainly will see further waves of the infection. Thankfully, many more people will be protected from severe disease and death, but nonetheless, this virus will continue to spread in circumstances whereby more of us are mixing. So we will have to continue to take some precautions. I think particularly as we move into the autumn and winter period, we'll just have to keep the situation under review, because the last thing any of us wants is to have to step back from any of the lifting of the restrictions that the Executive will be considering. None of us wants to walk back, walk forward one step, take a step too many, ease too many restrictions too quickly, and then end up having to take 2 or 3 steps back. I think what we all want, what society needs, what the economy needs, is certainty. And I think it's up to us all to continue to do the right thing and to proceed carefully out of the current restrictions.
Rebecca, our public health agency now produced a contract, or the contact tracing service now produce a weekly outbreak and cluster summary, which provide the number of outbreaks or clusters by location. So that's available on the PHA website, which may help with some of your inquiries. It doesn't give specific numbers of individuals, but it gives numbers by location as well. So, Tara McLaughlin, Cool FM Downtown.
Yes, good afternoon. My first question is for Matt, and I just wanted to say that the expansion of asymptomatic testing has been hugely welcomed, but retailers raised some issues today with us that it's only being offered to businesses at the moment with more than 50 people in the first phase, and that smaller companies might miss out at this stage. Have you any plans to extend that?
We don't currently have the plans, but we're certainly working on the plans. What we're trying to do at the moment is grasp the low-hanging fruit, if you like, and the principles that we're following, the sectors that we've prioritised, are the ways that we can have the maximum impact in the shortest period of time. In the short to medium term, of course, we will be looking at the rest of society, and in particular those small retailers on the high street.
Thank you. My next question then for yourself, Minister, in relation to do not resuscitate orders, we've heard some concerns from MenCap about these in England.
Sorry, Rebecca.
Pandemic. Do you have any concerns about how they've been used here at all?
So you froze there slightly from our side, Tara, there briefly, but I think I got the gist of your question. The decisions about cardiopulmonary resuscitation, I believe, are best made as a part of a holistic approach to advanced care planning, which includes timely, honest and sensitive discussions with a person to identify their wishes, their feelings, their beliefs and their values for their future care, and that includes where they are content to discuss this, their wishes in relation to cardiopulmonary resuscitation in the event of cardiac or respiratory arrest. But I will say blanket decisions based solely on age or disability, in my view, are discriminatory and unethical.
Yeah, just to clarify, the question is around people with learning disabilities. So I just wanted to know if you had any concerns about how they were used for people with learning disabilities here, and are you aware if the RQIA is investigating?
They weren't used here. That blanket approach was not taken in Northern Ireland. Okay, thank you.